this is really an hot topic because there are those new drugs which are really game changers in migraine prevention because they offer a lot of additional benefits to patients. However, there are also some shortcomings related to those treatments, and one of the major shortcomings while we are discussing if they should or should not be first-line treatment is the direct cost, because the direct cost is much higher than the conventional drugs. So here we have to consider several things. First thing is that so far we do not have studies, head-to-head studies comparing all drugs with the monoclonal antibodies to address if they are more effective. There's only one single randomized study comparing a monoclonal antibody with an antiepileptic, but the primary endpoint of this study was not efficacy, but was tolerability. So we do not have enough data to say if they are better or not better than conventional drugs. So we have the high direct cost, and we have to make treatments also affordable from an economic perspective for the society, because we have to give treatment not only to patients with headache, but to all the patients, and so we have to allocate the most expensive treatments to patients who are more in need of them. And so if we have a patient with low burden of headache, maybe we can consider as first-line treatment also the conventional drug, because often in those patients a short course of treatment is sufficient, and so also conventional drug can work in this sense. Whereas we can prefer the new drug, the new and most expensive drugs, in those patients who are more in need of the treatment. And they can be represented, for example, by those having a very high frequency of migraine or headache attacks, those of medication overuse, and those who have comorbidities which preclude the use of the conventional drugs. And it's important also to point out that considering the peculiar patient's characteristics, in some patients the oral drugs, the conventional drugs can be preferred. Let's think to a patient who has headache together with depression or insomnia. In this case, you can consider an antidepressant as first line. If a patient is obese, you can consider topiramate as first line. So I think that finally to answer to your question, the right choice is not to consider in general them as a first or not first line treatment, but to select the right treatment for each patient.